She had spent 20 years in oncology research. Her Labrador had been smelling the cancer for 10 months before she listened. Dr. Yemi Adesanya-Koch was a cancer researcher at a university medical center. She had published 31 papers on ovarian cancer biomarkers. She was one of the leading voices in her field on early detection methods. She had dedicated her professional life to finding the compounds that could signal cancer before imaging could see it. Her Labrador, named Ada, had found one. Ada was 5 years old and had been with Yemi since she was a puppy. She was a calm dog, methodical, precise in her attentions. She had begun pressing her nose against the left side of Yemi's abdomen approximately 10 months before the diagnosis. Not constantly, but consistently, every morning, every evening, the same spot. Yemi had noticed it in month 2. She had dismissed it as a behavioral quirk. In month 4, she had asked her husband if he noticed it too. He said yes, it was the same spot every time. In month 6, she had asked a veterinary behaviorist at a conference. The behaviorist had said some dogs develop focused attention on inflammatory sites in owners. She had filed this under interesting and continued her work. In month 9, Ada pressed her nose to the left side of Yemi's abdomen and looked up at her for a long time. Yemi looked down at her dog. She thought about the 10 months. She thought about what she knew about volatile organic compounds. She thought about the papers she had read on canine olfactory cancer detection. She thought about the fact that she had not had a pelvic exam in 4 years. She made an appointment. If you stay for stories about what animals notice before we do, you're in the right place. Subscribe so you don't miss the next one. The ultrasound found a 4-centimeter lesion on her left ovary. The surgical pathology confirmed a stage IA ovarian adenocarcinoma, confined to the ovary, no spread, no lymph node involvement. Stage IA ovarian cancer has a 5-year survival rate above 90%. Stage 2 IC, the stage at which most ovarian cancers are diagnosed because symptoms are nonspecific, has a 5-year survival rate below 30%. Her oncologist, Dr. Blessing Nyanda Nwosu, said the words caught early, surgical candidate, excellent prognosis. She also said, your dog identified this at a stage where it was curable and before it had produced any symptom. Ovarian cancer is called the silent killer because it produces volatile biomarkers that imaging misses for years. Your dog's nose was your early detection program. You are the first patient I have had who ran the clinical trial on herself without knowing it. Has your animal ever done something you couldn't explain until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard. Yemi is 3 years out from surgery. She is cancer-free. She has launched a clinical trial on canine olfactory ovarian cancer detection at her university medical center. Ada is one of the pilot program dogs. She is the reason the grant application existed. Every guardian deserves to be recognized, even the ones who press their nose to the same spot every morning for 10 months, while the oncology researcher in the house told herself it was behavioral. If stories like this matter to you, subscribe so you never miss the next one. The research is ongoing, the trial is enrolling, the results are pending. Ada is 6 years old. She presses her nose to the same spot on Yemi's abdomen every morning. The scans are clean. The spot is quiet. She checks anyway. She always will. Tomorrow there's another one. And there will always be another one. Because they are watching. They have always been watching. And they always will be. Subscribe so you never miss what they know next.